Welcome back to the Simplify Senior Transitions podcast. I'm Corpus, a senior transition specialist and real estate expert, and I help families navigate the often overwhelming process of selling a senior's home while transitioning them into the right living environment. Finding the right senior living community isn't just about the right location. It's about having the right people guiding you through the process. And one of the most powerful tools in making senior transitions easier is collaboration between professionals. That's why I'm excited to have Melo with me today. She's a certified senior advisor and the owner of Oasis Senior Advisors NorCal Greater San Jose, where she helps families find the best senior living and care options. But what makes Nickell unique is her background in marketing and partnerships. She understands the power of teamwork, networking, and co-marketing in senior care and how it benefits both families and businesses. Today, we're diving into one, why collaboration between professionals is crucial for senior transitions. Two, how co-marketing benefits families searching for senior care. Three, how families can build their own care team for better decision making. And four, why networking in senior care makes all the difference. And of course, some fun rapid fire questions at the end. If you want to learn more how partnerships, collaboration, and teamwork make senior living transitions smoother, this episode is for you. Let's get started.
Welcome to the Simplify Senior Transitions podcast, where we help families navigate senior living, real estate, and everything in between. Hosted by Senior Transition Specialist Dale Corpus, this show brings you expert insights, real solutions, and stress-free strategies to make senior transitions simple. Ready to dive in? Let's go.
Okay, and we are back. Nickell, welcome to the podcast. How are you today?
Thank you. I'm doing wonderful. I'm so excited to be here today, and I've been seeing all your great work, and I'm just so thankful to be a part of it.
I'm glad that you were, willing to join and be a part of this podcast. And I think that what you do in the senior living community is so useful, so helpful. And I wanted you to be able to share what you do to the listeners. So, can you share a bit about your background and what inspired your transition as a senior living advisor?
Yeah, so my background started in tech in the Bay Area about 35 years ago, and most of those years in partner marketing. And, the last 4 years or so, I kind of say that post-COVID, that I just really wanted something more meaningful,
Mhm.
just to follow my passion. And I'd always really enjoyed working with seniors. And my parents are entrepreneurs. My mom still is a salon owner at 84 years old. And we had a scare with her health about 2 years ago. And I just said, there's some calling that I need to really think about something different that I can do to help her and to also help my own in-laws that live here. So she lives in Idaho and she's doing great now that she's over her health scare. But it really forced me to look kind of just within and do some soul searching and talk to my husband about what can I do to transition to something that's more meaningful. So I did a lot of research and I found Oasis Senior Advisors, and I took a leap of faith and purchased a franchise in a local territory here in Northern California.
Perfect. Speaking of territory, can I ask you what your territory in the Bay Area is so that our listeners know?
Yeah, so it's Northern California right now. I'm the only one that serves from Sacramento North. So I could go all the way up to Redding. One of the things that we pride ourselves with Oasis is we visit every single community first. So many times we're doing that virtually. So that's kind of a carryover from COVID, but I do like to visit them first, no matter what. And we have 140 of my colleagues nationally that work for Oasis Senior Advisors.
Perfect. What's the biggest misconception families have about working with a senior living placement advisor?
I think the biggest one is they think that there's a charge, and it's for free. I completely do it for free. I want to make sure that, I find the best living option for them, and I work with the local communities too. And that's really how I make sure that I'm working with them directly. But yeah, the families, it's completely free.
Okay. And what should families know about the risks of trying to navigate finding a community for their senior loved ones on their own?
Yeah, that's such an important question. And I just came back from conference and we talked a lot about this.
Mhm.
And, families often start looking on Google, because they just are nervous about what's going on with their parents or senior loved ones. And so they start, let's get this done and let's get this over with. But, when they're doing that, the risks are, they don't realize that it really is what we call in a kind of our areas, spray and pray.
What is
So they get on lists that are actually selling contact information, and it's really extremely hard to get off the list. I do have a lot of my clients that are like, I don't want to work with that online provider. I want to work with someone locally, and it is very difficult to get them off the list,
Yeah.
to
Got
get the
it. Got
family
it.
off. Yeah.
And how do you help families who feel overwhelmed by senior living choices?
So, I really just, it's so unique to each family. And I typically am working with the adult children, but many cases I'm working with the seniors directly. We have a lot of independent seniors that live in the Bay Area and they want to do the work on their own. And, sometimes, and the reason that I went into this too is I see in the Bay Area that we really are, there's many of us that are considered the sandwich generation. And we have, um, many have young children at home, and then we have our seniors, and then we're working full time and dealing with the traffic in the Bay Area. Can be sitting in traffic sometimes up to 2 hours, or sitting on calls and not even leaving your house the entire day. And then having to think that you have to now research for your parents in finding them a community. Really what I do is it's one call. I sit with them. I, love sitting with the adult children. I can do it over Zoom. I can do it face to face. I really meet them where they are. It can be a phone call. And then I just want to understand more about what it is that they're going through. So I'm listening a lot. I'm asking questions. Where is it that they love to live? What are the things that they love to do? What are the things that they aren't doing anymore that they wish that they could do? And understanding more about that helps me really guide them. And it really is a guided solution. So the questions that they're not thinking about are the questions that I'm asking, but it really starts with just listening and understanding their needs and then putting that recommended plan in place.
Okay. And so a lot of times, when families are coming to you, at what point when they're starting thinking about senior living communities, do you recommend that they start a conversation with you? Like how early in the process?
Yeah, I wish, I wish that they started earlier than later. Especially when the parents, the seniors are still doing well. When they get to the point where their memory, they're having memory issues or they're not able to walk anymore, or they're bedridden, um, if they would kind of look, and really reflect on what's going to make their parents happier and whether, we can just have a conversation. Obviously, there's no charge, like I said before, but just having that conversation with the adult children and going, what is it that you want to change for your parents? And trying not to be in denial. Sometimes it's hard. It's very difficult because we're looking at our parents as they've always been there for us. And sometimes we don't recognize what they're going through until someone else might step in and go, you should probably look into this to see what's going on. So I would say sooner than later. I really recommend, even to my friends,
Mhm.
the more we can do activity wise, the better. Adopting healthy habits to help reduce the concerns of Alzheimer's is really high,
Mhm.
and dementia is extremely high. So, yeah, I would say sooner than later.
Okay. Right now I want to segue into different types of questions that actually deal with your forte, collaboration and partnership. So my first question is, how do partnerships with professionals like real estate agents, financial planners, and care managers help make senior transitions smoother? And also, who do you recommend families include on their transition team?
Okay. So with partnering with professionals, I love this so much. And that's one of the things I love most about working in tech is being able to work globally and working with our partners and resellers. So this is I love being able to connect the dots. So, I'm working with real estate agents, movers. I have actually traveling nurses that I work with. And, it just depends really on the need of the family. And there's so many services out there that before I started this, that I did not have any idea. So really in it, whether it's connecting with the veteran services or connecting with SourceWise, connecting directly with the hospitals, there's a lot that you can connect with professionally to be able to have that team that you work with together. But on the family side, the transition team, to point out your other question, is that one is so unique to the family. In many cases, the family, for example, a mom has lived in her house for 50 years. And I have family going through this right now, where each time she goes to a particular room in her house, she just gets overwhelmed with the amount that she has in her home altogether. But in one particular room, she keeps thinking that she's going to go in and organize, but she's getting more tired and more frustrated when she goes in there. So in this case, I would bring an organizer in and really help. And sometimes it's better to have the organizer come in versus your own family member, because your own family member is so attached to things or not attached to things, where the mom may be too attached, but an organizer can come in and really work through the questions that need to get done and help the family meet their goals.
It all makes sense. Can you share a real life example of how collaboration with another professional made a significant difference for a family?
Yeah, absolutely. So I recently worked with another family who needed to sell their home very quickly, but they also needed to move immediately. So many times the family is not aware that the mom or dad can move out and the family can do what they need to do. And in this case, it's really working closely with a real estate agent, and especially an SRES who works directly with they're used to working with seniors directly and the families of seniors. And then also working with a company like Elder Life Financial, which is part of actually my company, where they are very recognized in the industry, and they'll go in and actually help the family understand how to work a bridge loan. And, this type of thing, it's so seamless to be able to connect the real estate agent and Elder Life Financial with the offerings like myself, where I can pull in like the mover or the organizer, like I talked about before, or even in-home health that can really travel with the family directly to a community. And then that way the family can do what they need to do to take care of the house without the parents actually there. And there's not any stress, and the parents can be where they need to be taken care of in a community if that's what they decide to do. And then the home can actually get sold, and they can use that funding to be able to pay for the community itself.
Yeah. Can I ask you a little bit more about Other Life Financial? Because that's a new term for me, and it sounds like it's more so connected to your company and your franchise. What kind of
Okay.
services do they provide?
They provide so many services. So they do the bridge loan, they do the reverse mortgage, they provide legal support. They
Mhm.
provide a lot of information about veteran services, which is kind of like the gray mystified air out there. It's like, how
Yeah.
do I find someone local? In fact, I just got a call the other day and I'm like, oh my gosh, I've been looking for someone like you. So they really help just identify the needs. Like myself as an advisor, they do the same thing. They know what questions to ask, and they're
Yeah.
not all over the map. They're very specific in what they're asking for to get the answers that they need. And they also do long-term care. So that's another one that they'll put you in touch with a long-term care funding provider. And many families know that they have those funds available, but it's very hard to access. And so our company will really help them do a match to find the right company to get them the funding that they need and get those questions answered for them.
Okay, got it. I know you came from tech. So coming from a corporate partnering background in Bay Area tech, how has that experience shaped how you collaborate and build partnerships in senior care?
Yeah, I mean, I rely on so many things that I learned in the tech world, and it just the customer service
Yeah.
is the biggest, and the professionalism and the respect, and a lot of things that I feel like I want to teach my own children, who are 20 and 29 years old, and teach those values. And that's really, I feel like, the companies that I worked for in tech, we really valued our customers, and we want everyone to be heard and treated with respect. And so that was the two things. And then the professionalism, but the partnerships and the strategic co-marketing. And I come from the partner marketing teams where we would put together campaigns cross-functionally, and it could be working with small partners or trade show vendors or service provider companies, depending on what type of trade show or event that we were doing, but really being able to connect those resources. In fact, in my current role, I tend to look for um, trusted partners to have a little bit of technology in their background, because I feel like in some respect, I feel like we speak the same language.
Yep.
And I have a partner that I work with, and we go in together on a lot of whether it's going into communities or going into skilled nursing or hospitals or rehab. And his product is it's connected home living, which is a product that goes on the wall, and it monitors heat detection of a family member. So you don't have to wear the little thing on your neck that never gets charged. In my case, my mom forgets to charge her medical alert. And so that's something that where, I see that tech is just, and it may just be part of my DNA, but that's where, and right now we're actually working on a co-branding campaign where several of us brought, we looked at like, we really want to work together, and it's very much a cross-functional small team. And we want to start doing educational series, not only for families, but also for skilled nursing to see if we can help them understand more about it could be dementia, Alzheimer's, helping them connect the dots of what information is out there. Because, with the hospitals and the providers at the hospitals, they're so busy heads down working with the patients that they just don't have time to go do the research. So we really want to be an outreach for them as well.
Got it. Why is co-marketing and collaboration so important in the senior care space? And how does it benefit both professionals and families?
Yeah, I think it's so important because I hear a lot of people like there's a lot of competition, right? But if we, I have like people that are in the same space that I am, but I never like to think of any of them competition because we all are unique. We're all unique individuals, and we all bring something different to the table. And it's hard to do, I work at home every day by myself, like, and I'm out in the field, but when I was with a company, we had people around us all the time, and we had to work cross functionally. And that's one of the things that I just love doing is being able to bring the right teams together, and building that trust is so important. And, I just feel like if we can connect the dots and help each other grow, and if, I understand really what your vision and your mission is and how to help support you in the best way, and understanding really what your territory is and what your sweet spot is. And I'm up in that area or even down here, wherever you serve, I want to be able to be out there and go, I have a great real estate agent that I'd love to connect you with because he would be great at these things. And I love to learn so much about who I'm working with because I love to be that professional out there doing those things plus my regular job. I just feel like it's kind of part of it for me.
Right, right. What advice would you give to senior care professionals looking to network better and build authentic, meaningful partnerships?
Great question. I would just say, being authentic, people can tell when you're fake. And just take the time, like I said before, and this applies to anyone,
Right.
just listen more, talk less, and really understand what the needs and values are of the other person. And it can really apply to anyone. I think that's just professionalism. And I think the more you can learn about the other person, and in this case, your professionals that you're working with, the better you're going to be, because you're going to be able to connect those dots much easier than if you're doing all the talking. And I also am just a firm believer about um, letting other people shine. Just, giving them the kudos, recognizing
Yes.
the little nuggets that they have that are so unique, that let them shine. And I love doing that more and more and more. I think the older that I get and the more that I learn, yeah. So I would just say more listening, less talking, unless you're, like today, you're asking me questions, but just letting other people shine.
No, I totally agree. Like, believe it or not, I hate talking to myself, but I love asking other people about what they do.
Yeah.
Um,
Right.
but let's see. I want to switch questions again. Let's segue into how families can take advantage of professional networks. What are the advantages for families who work with a well-connected placement agent like yourself?
Yeah. I mean, first of all, they're able to immediately tap into a vetted, reliable network. And there's so many, like I mentioned before, there's so many different offerings out there that I did not know that existed. And I probably just took it for granted. Like, even the difference between independent assisted memory care, what those differences are, right? And now understanding the communities that serve those, like that have those, and what the differences are there. But on the other side, just being able to recommend those professionals that meet the needs of that family. And, one thing that I mentioned earlier was like the flight nurse. And I had no idea that there was a flight nurse. I knew that there were companies that would take seniors across the United States or take them on trips. And I thought, I'm going to do that. Well, I found out that you actually have to be a registered nurse with this company that we use, and how that comes in handy and their value add of having a registered nurse travel with a senior is something that I feel like we take for granted, especially, they could be in some cases traveling with a senior that has dementia or potential flight risk. And think of that, traveling on a plane.
Yeah.
So I think that that's the network behind the scenes that I feel like we kind of do that they may not be aware about. With assisted living, it requires a 602 only in California. I have my colleague from Idaho going, "What the heck is a 602?" And I go, "Well, don't you have like a doctor's sign off of what the baseline information that for your client?" And they said, "No, we don't have that." And I said, "Well, California, we have to be a little bit different, obviously. But in this case, it's assisted living. You have to go with the 602, and it has to be signed off. I mean, there's like a path that you have to follow, and there's actually concierge doctors that you can do something over Zoom. You can actually do it over the phone. You don't have to use a Kaiser doctor. You have to pay out of pocket, but
Mhm.
we pretty much have the ins and outs of, I've had clients say, "Well, I have Kaiser, so I'm going to have to wait a long
W-
time to get that done." No, we have a solution for that.
What's something families don't realize about the behind the scenes teamwork that goes into helping them?
I would definitely say that, as I mentioned, like with flight nurses, we have realtors, fiduciaries, and there's a time in the process that those things need to get done.
Mhm.
And I'm still learning about like all the offerings that fiduciaries offer.
Mhm.
And we don't really have that many of them in California,
Mhm.
but each of them do something a little bit different. A fiduciary, for example, can actually act on behalf of a senior that may not have anyone, a family member local, or
Mhm.
they may not really have a good relationship with their children, and a fiduciary can help take things like that over on behalf of a senior. And or even like attorneys, like there's elder law life attorneys who can help with trust, and there's attorneys that only focus on seniors. So again, there's just a wealth of information and a network, I would say, especially now as we're moving into an era where Alzheimer's and dementia is tripling. I think by 2030, it's supposed to be tripling. Yeah, it's going to be tripling by 2030.
Mhm.
And I don't know the numbers, the exact numbers, but Alzheimer's is the biggest one under the entire dementia umbrella. So it's so important to have those cross-functional team members and professionals that know how to work with seniors.
Yeah.
And it's important, even the baby boomers. And I don't know if you know this fact, but 10,000 seniors are turning 65 every single day, just in the United States of America. It's just unreal. 10,000 every day.
Wow. Wow. How do you see the future of senior living placement evolving, especially with more collaboration and technology?
Yeah, it's going to continue to grow. AI is the big boom right now, and everyone's talking about AI. And a lot of companies are incorporating AI into their products. And it's not just it's for seniors and everyone to be able to leverage, but there's so much technology that's available now for seniors to leverage and companies to build it in to make it easier on healthcare professionals. And the example that I gave you earlier with the connected home living is that data that comes through is something that you can see the trending data, over, and you can actually reduce cost of what the healthcare cost or in-home care costs. So, for example, you can pay an in-home care company to come into a community to provide extra services to a senior,
Mhm.
and the families are paying for that. They're paying for all that in-home care to make sure that their parent may need to have additional companionship, but they may only be able to pay for 1 to 2 hours a day. Well, now with a product like that, you can bring that product in and they don't have to pay for in-home care for 24/7. So it's a cost and reduction. Not only that, the families can see not only what their parent may be doing, not an actual camera, but just the outline of the
Mhm.
parent, but they also get the data and the behavioral patterns and the trends. The
Mhm.
hospital can get the same information. Any of the health providers can get that information. So they can start to study more about the behaviors of those particular individuals. That's one way. There's so many different products that we can take into our communities or even be able to take into healthcare. So
And
I really see the collaboration and, you know, my role is kind of the conduit because I am out there in the communities and working with skilled nursing and hospitals. Likewise, I'm working with families and in-home care. And I love staying abreast on all of technology because I just think that it's so important to be able to be in front of that and make sure that we understand how it can be integrated to reduce costs and increase wellness for our seniors.
okay, got it. Um, I have a fun question for you. Um,
Oh,
what's one yeah, what's one thing most people don't know about you?
oh my goodness. Can I give you
Uh,
2 things? I'll
Go
be
for it.
quick. So the first is I lived on a farm growing up,
Okay.
and I love riding horses, and I learned
Oh,
riding motorcycles at about 10 years old.
wow.
And I still love four-wheeling and riding motorcycles. I don't obviously get a chance to ride motorcycles as much, but anytime I can go out and four-wheel in the country or on trails, I love it. And my other is skydiving. I've done
Oh,
it
wow.
once in my late 40s, and I'm ready to do it again. So anyone that wants to do it, I'm ready to do it again.
I haven't even tried that yet. Okay. Hey, what's one myth about senior care that drives you crazy?
Uh, maybe not senior care, but I would just say seniors that
Okay.
just like any one of us, we're all individuals, we're all unique. And you can't bucketize, oh, seniors are like that. There's a lot of stereotypes about seniors. And I would just say, we are all individuals and just like, any one of us, that's how I would like us to treat like our seniors as well. An individual that we're all human beings and we all want to be loved and cared for. And, back to the care part for senior care is finding those types of providers, whether it's communities, whether it's in-home care, whether it's home health, hospitals, looking for that care that really treats people as individuals and not, I don't know, just to make them treat everyone as human, I think is the biggest thing.
Yep. Yep. If you weren't doing senior placement, what would you be doing instead?
I would love to be a bus driver for seniors and take them either on day trips or take them fishing or just fun stuff or glamping. Glamping is a big thing now.
Yeah.
And just be the bus driver and take them on fun tours and perhaps go overseas, but I'm kind of like locally, I'd love to be their bus driver.
Yeah. Yeah. Um, any final remarks? Is there anything I should have asked you that I didn't ask you yet?
I can't think of anything. This was so enlightening. And I just want to say thank you, Dale. And like I said earlier, you've just been doing a phenomenal job out there. I hope that people are watching what you're doing and you're just out there. You're rocking it. So I'm glad to be a part of this.
Yeah, thanks so much. I mean, you know what? I'm having fun along the way, and it's just this kind of like, it was a little project that I had in mind, but I didn't know it was going to be turned into a lot of fun. And it's kind of like networking and almost like having a virtual coffee meeting, but it's now something that we could share as
Yeah.
media, like, and it's also helpful for
Yeah.
other people. So it's kind of, it kills many, it's like kills multiple birds with one stone type of deal, you know?
It
So
does.
yeah, it does. So I appreciate your being on. And so I just, again, this conversation has been incredibly insightful. And thank you for showing us how partnerships, collaboration, and networking make senior living transition smoother for families. Before we wrap up, how can families or professionals connect with you and learn more about Oasis Senior Advisors?
Yeah, probably the best way. I'm going to get my business cards with my QR code. But right now, I just say I'm going to give you my number
Yep.
408-343-8484. Or you can go to oasissenior.advisors.com and locate Greater San Jose.
Perfect. And for those of you watching, if your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation with me by clicking on the Calendly link located in the video description box for this episode in YouTube. You can learn more about my services at www.simplifyseniortransitions.com. If you have a quick question, you could DM me on Instagram at soldbydale. And if you found this interview helpful, please make sure to like, subscribe, and share this video with someone who might need this information. Thanks for tuning in. Thanks, Nickell, for being on again. And
Thank
I'll see
you.
you. You're welcome. And I'll see you on the next episode of the Simplify Senior Transitions podcast.